As the visionary behind the World Health Organization's Health for All Film Festival, Gilles Reboux bridges art and advocacy, turning powerful narratives into tools for global awareness. Since the inception of the World Health Organization's Health for All Film Festival in 2020, Gilles Reboux has served as its concept designer and principal coordinator. He possesses extensive experience in audiovisual production, particularly in sectors including sustainable development, humanitarian aid, and global health. Gilles has collaborated with several international organizations and conducted filming missions in nearly 50 low and middle income countries. With over 20 years of experience in various job roles, including teacher, actor, consultant, and video producer, Gilles' notable achievements have been highlighted through his production work. He has been an advisor in audiovisual and multimedia communication for projects related to the World Health Organization, the United Nations Development Program, and the Joint United Nations Program on HIV/AIDS. At the World Health Organization, Gilles serves as a Health for All Film Festival producer, where he invites renowned artists and activists to discuss public health concerns. Welcome to this interview, Gilles Reboux. It is an honor and a pleasure to have you with us today.
Thank you very much. It's my pleasure indeed. Thank you for inviting me.
Gilles, how has your experience working as the leader of the Health for All Film Festival at the World Health Organization been? Please share with us some of the key responsibilities associated with your role.
Well, yeah, it's a concept I designed in 2019. In fact, we have Dr. Tedros as our WHO Director General, who has encouraged all the staff since he started his first mandate to propose innovation. And in 2019, he was renewing his call for innovations, and I proposed to him this concept of a film festival dedicated to health for all and to universal health coverage, which is one of the priorities for the WHO. And he approved the idea immediately. And I think the key responsibility I've had since then is, well, there are many responsibilities, in fact, but one is certainly in the concept and in the implementation of the concept to make sure that this film festival is serving the core mandate of the World Health Organization and is really used for all WHO staff, but also WHO partners and champions of health in the field who can use the film for creating health impact. So the health impact of film is really one of key goal of a concept. The mobilization of staff has been another one, and I'm glad that through the 5 editions so far, about 700 colleagues have participated as volunteering for the film festival process. For instance, helping me for the call for films, mobilizing their network, and also participating in the selection of films. Because it's important in the selection of film for us to have also the WHO expertise to be associated with the audiovisual narration that we would like to show. So other responsibilities have been to mobilize a jury of famous artists, to have also discussions with with partners and public institutions, NGOs, and different stakeholders around WHO who have helped a lot to mobilize their network as well for the call for films. So really the concept, just to end on that, that I insisted about was to call for films made outside the United Nations family. So that really people who are beneficiaries of the WHO recommendations or beneficiaries of WHO's actions can also tell their stories from their voice, to give the voice to the champions of health in the field. That's really one important aspect of this film festival.
Wonderful. I think it's a fantastic concept. Now, you have mentioned on several platforms that the World Health Organization receives around 1,250 short films from about 110 countries every year. Can you share insights into how collaborations with these artists and short film producers will enhance the success of the Health for All Film Festival goals for 2025?
The first result we obtained, and it was really fantastic, because initially I thought maybe we'll have 500 submissions, and in fact it was more than double. We managed to maintain an average of 1,000 submissions at every edition. As you know, we have had so far about 50 to 80 films selected every edition. So the total is 330 films selected in 5 editions. So this is a network of people who are really continuing to support this goal of health impact through film, whether they are professional filmmakers or health professionals or champions of health, not necessarily professional of the health sector. You know, all these people are participating edition after edition of a film festival in spreading the word. They are all, I noticed that a lot of them are really engaged to make the message about public health better known. And we have created a LinkedIn group which is called the Health for All Film Festival Advocates group. And it's a place where people can share their experience in how they use film for health education, for health promotion, and to create behavior change with a film to make sure that the health status of population could improve. So that's really the goal of this film festival, to mobilize a network like that of activists. And we have also, hopefully, I hope we can develop a research project so that we could also have a scientific evidence on how a film or a sequence of film can really be used for a behavior change. So this is one of the projects I have initiated with this film festival as well.
Great. It's a fantastic opportunity for many filmmakers over the world who want to showcase their work and connect with other filmmakers in different parts of the world. So great work. Now, given your vast experience in audiovisual production across sustainable development, humanitarian aid, and global health, how do you ensure that complex topics are communicated effectively to diverse global audiences?
In the 1990s, I've worked, and early 2000, I have worked on a series produced by the United Nations, which was called Azimuth. And it was broadcasted on 60 TV channels at that time. So I made a number of reportages of 10 minutes. The concept was to have a 10 minutes reportage on sustainable development issues. And in the concept I have designed for the Film Festival of WHO, I have proposed that we select only short films from 3 to 8 minutes. So complex, of course, a complex topic. It's not easy to explain in 30 seconds or 1 minute. So the length is key. But on the other side, if it's too long, it's not easy to use. So it's not it. People need more time to watch it. And for instance, a professor at university with a format of 6 to 10 minutes, they could maybe show a few films and have a debate with their students. The other key element, I would say the second key element for me, is how we combine in any story, whichever the length, how we combine emotions and the key information. And when I say information, of course, it has to be, according to the WHO, scientifically approved information, to make sure we don't convey misinformation or disinformation about health. And somehow the audiovisual language is universal, because we have, of course, linguistic dimension, which is not universal, but the visual narration, the audio track can help us to raise emotions really in any culture, in any I'm not saying that cultural aspects are not playing a role, and that's part of a study we would like to make also in terms of behavior change, how the cultural components should be taken in consideration. Then, to end, of course, on this question of complex topics to be conveyed to global audiences, because it's not easy to make a film which would really speak to anybody in the world, any age group, any cultural context, it's so difficult. So it's more efficient when it's better targeted, and I think that's another aspect to be really developed when writing a dialogue for a fiction or a script for a documentary. It has to be well targeted so that the audience can really understand the complexity, and of course the target also has different level of education, so we need to know whether we speak to a very wide audience or to specialists.
Now, what are some of your outstanding experiences collaborating with international organizations such as the World Health Organization, the United Nations Development Program, and the joint United Nations Program on HIV/AIDS, as well as key figures in the film industry?
And I would say some outstanding experiences through these missions have been to meet champions of social development, champions of health development, and or people fighting for protecting their environment. And for me, meeting people who are on a volunteer basis are really dedicating almost their life, but certainly a lot of time and a lot of efforts to change something in their environment, in their group of population, in their community, has been an outstanding experience, really, to meet these guys. And I met also, of course, some leaders at international level, but it's a different way, because leaders at international level, it's their career, it's their job. But when it's somebody on the ground who is volunteering, with a lot of time, very little means, it's very impressive. And I think it's important to report and to film these situations, to showcase these actions in the ground, because these small drops everywhere are making the change, I think, for better life at a more national and global level, hopefully.
Thank you for sharing. Now, what key themes or public health issues will this year's Health for All Film Festival focus on, and what will be the highlights of this year's film festival?
So the film festival has always tried to cover as many as was different domains and topics. And in order to create a special focus every year, we have had some special prizes. So one Grand Prix, or at least a couple of Grand Prix, are for any health topic, like universal health coverage. We had this Grand Prix. We had a Grand Prix on health emergencies, which is more specific to of course, crisis situations, but any health topic is concerned by emergencies. And we have had this special focus on climate change and health, for instance, or we had sexual and reproductive health. We had last year, on the occasion of the Olympic Games, we had physical activity and health, and so on, mental health, different focus every year. And for 25, we are working on the plan to have digital health as one special focus. And the other one would be social determinants of health and equity in health. So we are developing the concept on these special categories. Digital health is certainly a challenge for the future. It's still ongoing. It started to more and more doctors and health systems are using digital health, but it's going to be developed, of course, and to develop more. We could imagine that we would receive films which are a bit science fiction. They could be about the perspective in the future, how things like that could be used. And the idea also is through the films to be received, I hope we can cover the different angles, or like ethical aspects of digital health, or there's a bridge between social determinants and equity and digital health, because the question of accessibility is always also, every time there is a new technology, a new treatment, a new way to develop something in the health system, the question of accessibility for all is always on the table. Stories like that could make a diversity of proposals in our future selection, I hope.
Very exciting. We're really looking forward to the Health for All Film Festival this year. Gilles, thank you for generously sharing your valuable insights with us. Your leadership of the Health for All Film Festival at the World Health Organization is commendable. We extend our sincere appreciation and wish you the best in all your future undertakings. Thank you.
I thank you indeed very much. Thanks for the invitation again. And let's hope to have more and more film production in the future about health to explain, to make things understandable to the widest audience. Thank you very much.
Definitely. Thank you.